I'm Dr. Nandita Palshetkar, IVF specialist practicing for 30 years, running IVF centers at Leelavati Hospital, Mumbai, Fortis La Farm, Delhi, Fortis at Mohali and DY Patil Hospital in Navi Mumbai, and a lot of other franchisee centers. I would today like to talk about the injections of IVF. I think that is something that most of the women are scared of. We get a lot of injections. But remember, during the cycle, you need to take injections for 10 days. We start the injections on day 2 of the period. And the latest injections are so good that the injection needle is as thin as a hair. So you don't even get any pain. And there are a lot of injections which are given subcute so that the pain factor is much lesser. So you start injections from day 2 of your cycle for 10 days after that. And during those 10 days, sonography is done. And these injections are to be taken either in the morning or evening. You fix up one time. And then once the day 6 or 7 is reached and the leading follicle, meaning the anda jo hai, the egg reaches about 14 mm, then you start a second injection. The second injection is usually for 3 to 4 days. And then you're ready. Once these injections are done, you are admitted into hospital. On the last day, usually there's only one injection, which is for triggering, we call it, for maturing the eggs. And once these injections are over, you get admitted into the hospital and for ovum pickup. So these injections are pretty harmless. There's not much side effects. Occasionally, patient has had an allergic, on the side they get itching or something. So then we change the injection. Then the other side effect is that we don't get any eggs. Your body just doesn't respond to the injections. Then we have to change the protocol, increase the dose, to get eggs. And the third side effect is producing too many eggs. Now this is, fortunately, today we have tools with which we can prevent this hyperstimulation. So we check the AMH of the patient. It's a blood test called serum AMH. And depending on that, we individualize the dose depending on her weight, her AMH, and your previous response. So these 3 factors are taken into consideration and the injections are given. And also, to prevent hyperstimulation, we give a trigger called DECA trigger. During the stimulation, you may feel a bit heaviness in your stomach, but otherwise it is fine. And usually with these injections, a patient does not put on weight. I mean, this is a standard question which is asked by everybody, because we are not giving you the hormones of pregnancy. So you generally don't put on any weight. I think these injections are injections, but they're pretty painless because the technology has advanced so much that you have injections with needles which are very thin, and very small quantity of injection is given because the latest injections are filled by mass, and it's like 0.1 ml of fluid. So when the quantity is less, the pain is also less. So you need not get worried about the injections. You can take them safely.